Hope Christian Health Center is doing impactful work in our community when it comes to providing access to comprehensive care to all, regardless of circumstance.
Here to talk about their new community health project outreach clinic and their 10-year anniversary is CEO Steve Flores. Steve, how are you?
I'm very good, sir.
Good morning.
So tell us a little bit about the mission of the medical outreach clinic.
Okay, so Hope Christian Health Center, we have two statuses. One is as a federally qualified health center created to serve the neediest population across North Las Vegas and Las Vegas. Our status is also as a faith-based ministry, so our mission is to glorify God through affordable and excellent health care. And what that means is that we don't turn anybody away. If people have needs, we cover all insurances, Medicare, Medicaid, and even the uninsured. We have special programs, special sliding fee schedules for them where a $200 normal visit will cost $40, and as well as that, we have our own pharmacy to help with the discounts for the meds. As we know, it's one thing to diagnose, but the poor patient, they need their medications.
Right.
Now, how long have you all been serving the community, and maybe talk to us about the need here in
Oh,
Nevada?
wow. So actually, August of next year makes 10 years, and that's a miracle in itself. We started with nothing. We didn't have a building, we didn't have a doctor, we had a laptop and a table, but we had a vision and a lot of prayer. Now we're up to 12 providers. And what we actually do we have two. We have our standalone clinics as well as what we call Mach 1, which is a mobile unit in order to get to the people who can't get to us. And we've been doing that since the pandemic started, where most clinics closed or went to telemedicine. We did the opposite. We went out and we were serving patients in high schools, at food drives, with other nonprofits. Anywhere there was a need, we would go.
You mentioned your 10-year anniversary. Congratulations on that. And clearly your program is expanding and reaching more people. What kind of community outreach programs do you have, or what kind of events do you have coming up to celebrate that?
Oh, we have many. So we partner with a lot of people. So we're not just here to serve the community, but we're also here to serve and partner with those who serve the community. So we have our mobile units out 4 or 5 times a week now throughout Las Vegas and North Las Vegas, and we've been partnering. Last week with the Metro Police, we go into areas that are just high in need, where people are lacking food, struggling to pay their rent, and healthcare is always put off to the side. So we pull in and we help them, and then not only do we see them again, but we actually deliver them to them medications. And our team consists of our providers, our medical assistants, as well as community health workers who are bilingual. So we're able to identify these other needs outside of healthcare and partner with other organizations to help them with their needs. But off the top of my head, I know we work with other nonprofits. We support them and they support us on events. Same thing, we partner with the City of Las Vegas. We partner with the City of North Las Vegas. We're beginning the beginning steps of partnering with Metros. We did just do an event with the Metro Police in North Las Vegas, and many other nonprofits that we work with. And our patients, our Medicaid patients, also have what they call managed care groups, and we partner with them to just find those patients that really need to get to in front of a doctor. And once again, we don't wait for them to come to us. We go to them.
Talk a little bit about the impact you've seen that your services have on people who are really in need.
Oh my gosh, the impact has been great, and far more than we imagined when we started. We see now all of Hope, we have between 1,500 and 1,600 visits a month. We see that, and we see the quality of life. The city of Las Vegas has put together a recuperative care for the homeless, and we, thank God, we're able to operate it for them. We see people that have been in the streets homeless for years get long-term shelter. We get them if they receive the benefits that they haven't received through a caseworker, a SOAR manager, and our medical director. And people that have gone to the streets to heal from wounds or surgery, we have a place for them now to come and heal. And even when they're there, whatever they're there for, we take care of. However, we begin the primary care process, identifying blood pressure issues, diabetes, heart disease. And when they leave there, they're healthier, they have their medications, and they have a team to come back to.
This is a great mission that you guys have, and a wonderful organization with the outreach, with the, even covering uninsured people and reaching out to people. So I'm sure there will be someone watching at home who they themselves or know someone who could do with this support. So to learn more information and to find ways that you can also support, visit hopehealthvegas.org.